All right. Hi, everyone. My name is Dr. Sasha, and I'm your dual doctorate, board certified, award winning physician and researcher, best selling author, international speaker, and expert in chronic disease management, preventative health, and medical cannabis. And I'm here today to talk to you about direct primary care. Our direct family care plan is what is a direct primary care model. I have helped patients who are super frustrated with healthcare. They're frustrated with the cost of healthcare. They're frustrated with not being able to see their doctor and get care. And they're paying these high deductibles and really not getting the kind of care that they need. So I help patients using my direct family care model to provide care to patients at affordable, accessible, high quality healthcare. So you don't have to deal with the hassles of insurance. So I'm here today to talk with Dr. Josh Uhmber. In the meantime, you can always go to my website at directfamilycare.com and check it out. And there is a free bonus there for you if you want to download. 5 ways that you can save thousands of dollars on your health care. And you can always download that PDF. And so, but today I'm here with Dr. Josh Uhmber of Atlas MD, and I'm going to let him introduce himself, but I'm super excited because Josh is really one of the originators of this direct primary care model. So I'm really excited to have you here today, Josh. Thank you so much.
Absolutely. Thanks for having me on.
Yeah. So we're going to chat. And of course, this was supposed to be a live video. We had a little technical difficulty there, but that's okay because we found a way around it. So if you have questions after this, when it gets posted, please don't hesitate to contact us. You can do that through our website at directfamilycare.com or give us a call at our office, 813-641-0007. All right. So Dr. Josh, introduce yourself for everyone listening, please.
Sure. I'm a family physician, and I co-found Atlas MD with my partner, Dr. Doug, back in September 2010. We were fresh out of residency, basically, but we knew the healthcare system was broken. We'd seen our peers a few years ahead of us quitting medicine in just a few years post-residency because they were so frustrated with the process, the payments, the paperwork. And for people who worked over a decade to get their dream job, that says a lot. So the ignorance was bliss. We knew what the current model held, and that was about a 50% chance of burnout. But starting a new model at least gave us the hope that it could work better. And thankfully, 8+ years later, it is thriving and growing. We've been able to help over 550 physicians convert to the direct care model in the last few years. So it's very exciting.
I mean, that was really innovative of you to be involved in something that really there wasn't a whole lot, at all about it. You saw a broken system and you started, innovating ways to help patients really at the center of this. This is really why we became physicians, right? So we can help as many patients as possible, not to be bogged down with paperwork and bureaucracy and all of that stuff. So I think that's really cool. So for someone who's listening, we've been using the words direct care, direct primary care. Can you give a little bit of background and help that out?
Yeah, I think it's the idea that we're going from a third-party relationship with doctors, patients, and insurance companies to a direct relationship between physicians and their patients. Not because insurance is bad. I think it's a tool, and often we're using it incorrectly as a tool. But the idea is we can make a lot of healthcare very affordable. If physicians accept responsibility for the problem, we also get to accept the opportunity to fix it. And that's what we looked at when starting our practice and saying, well, why are lab tests expensive? This isn't new technology. It's done all the time. The same market forces that would drive any other product down surely apply here. And then Dr. Doug went to our local lab and found out that they would give 95% discounts to physicians who bill directly. So we did that. And like, wow, what else can you get cheaper? And that problem-solving mode now that we're in when we're good third year and fourth year medical students. We're learning, we're troubleshooting. This is a migraine or a headache, but what type of headache? And ask yourself all these questions. But then you get into medicine proper, and we kind of quit trying to innovate in the business model. So we kept looking for ways to save money on meds, on procedures, on imaging tests, so that we could bring the whole cost of care down. That way, if you have insurance, great for the catastrophic stuff, the big stuff, but for your average person who needs care first, we were able to make that affordable. And I think the best way to do that is through a membership model, because then we can do things that you can't do in an insurance-based thing. We can offer unlimited visits, no copays, free or discounted procedures. An EKG costs 36 cents, wholesale cost in our office. The coffee in the waiting room costs more than that. So, but if you have to bill insurance and go through the headache and have 7 employees per physician to play the insurance game, then you find yourself, your overhead's higher, so your cost of care is higher. And the more that we could streamline the direct care model, the more savings we could pass on to our patients. So it is just a membership model, insurance free, that continue to try to provide a high value at a low cost.
Yeah. You know, it's kind of interesting because when we went to medical school, none of this was discussed or taught. I mean, we had maybe some, minimal healthcare, you know, administration, lectures, but nobody really talks to you about how the nitty gritty of this works. I have med students and residents that come through my office all the time. And when I explain this to them, they're like, well, we're never taught this. I'm like, well, I wasn't taught this either. But here's how the system's broken. And when you consider how when we have patients who use a direct care type of practice are able to come into the office and have in-office procedures that we can just take care of. When we talk about the cost, I mean, it's so ridiculous to think 35 cents, right, for an EKG, or less than $1 to get a joint injection, things like that. Under this model, it's so much less expensive for the patient. At the end of the day, I know I personally pay a ton of money and have paid for many years, lots of money to have great insurance, but have these massive deductibles. I think at one point, our family deductible is like $13,000 per person. Individual deductibles are $5,000-$6,000. When for a plan like this, for less than, about $800 a year, and so patients can have all their primary care needs met, either, just in office or with super discounted stuff. I mean, I had a patient who, had gotten their blood work done prior to us doing this model, had their blood work done, $1,500 for their regular blood work that we were able to get for $60.
Which is sort of a self-fulfilling prophecy for the average patient. Is they hear healthcare is expensive, they have a scenario like that, then they say, well, thank goodness I have health insurance if that's the true cost of care. And so it really is a defining shift in thinking, where you say, well, yes, blood work's $1,500, I want insurance to cover that. Or blood work is $30, $40, $50, $60, I don't need insurance for that. That's a tank of gas, that's a meal, that's less than my grocery bill, then I don't use insurance for that. For medicines that we can make, much cheaper through GoodRx or pharmacy coupons and other things, then we can help save our patients a ton of money that then justifies the membership. So they say, well, the patients will come and say, why would I pay for something I'm not using every month? So, well, have you ever paid for health insurance and not used it every month? Which is exactly what patients
Lots and
do.
lots.
Yeah.
Lots.
And then they don't necessarily see that as a venue for decreasing their premiums. So if you can help them to understand and say, well, how do I afford my insurance plus my membership with a doctor? That sounds expensive. But if we can say, how do you afford your insurance premiums without your direct care doctor? Because we did stitches for a young boy on Halloween night at 9:30 at night, and that would have been an ER visit for $1,000, $1,500 easy, that we did for free.
Right.
That child's annual healthcare cost with us is $120, $10 a month. So 10 years of his healthcare is now saved based on one procedure and 4 stitches. We can have this real paradigm shift in thinking of how we purchase healthcare, because it's become so affordable. I mean, we have supercomputers in our pocket now that, and if I drop it, I can go to the supercomputer store and get a new one. because the technology that used to be so expensive has been made affordable and accessible to the masses. And we can apply that same core value to healthcare in a lot of ways.
Well, and we get these discussions going with patients sometimes that have the same, concern. Like, well, I have health insurance. Why do I need direct care? And that's really helpful, And in the direct care model, we talk a lot about what insurance is meant for. Like, you don't use your car insurance for gas or tires, or that is for the big stuff. Your car insurance is for the big stuff, and that's what your health insurance should be for. I love it when people start understanding that primary care really shouldn't cost that much.
Right.
you know
It's our training, but we don't need a whole lot. We don't need an operating room or an
Correct.
MRI
Correct.
to do our job necessarily. So then, if we remove the biggest expense from running a medical practice, which is insurance, then we can bring that care down. If we focus on bringing value to our patients in every way, the primary care physician touches office visits, procedures, co-pays, the pharmacy, the lab, the imaging, the pathology. And now if we can do a biopsy for skin cancer, the procedure in the office is free and the pathology is $70. And that could be 700 most other places in the system. And you can get patients very comfortable with this idea that, all right, less insurance is okay. I don't use the insurance I have on a regular basis, but it's so scary to be in a broken system without some coverage.
Yeah.
Now they feel like their doctor's the best first phone call because they're going to take care of what they need and do it in a cost-effective way.
Yeah. And I love the convenience aspect for patients too when it comes to a direct care model, because once we get to know our patients really well, maybe they have to show up to work and they can't miss work, but we have the opportunity with telemedicine visits to be able to help them. um,
Oh,
and we know them, and that's not something that really the insurance model really does a great job supporting. Is that convenience factor. Obviously, if there are things that we need to address and they need to be examined or whatever, that's a different story. But that convenience factor is so helpful. I have so many patients that maybe they're in the medical field, or they're nurses that work night shifts and they're sleeping during the day or whatever. um, they can't just come in all the time. And once you get to know your patients, and of course that's why we went into primary care, right? To have those relationships with our patients so we can get to know them and take care of them in just a great way, keep them healthy. So,
convenience or even necessity. And in a
yes.
weird way, that the system is designed for
Yeah.
9 to 5 people, and very few people work well 9 to 5, or they're busy 9 to 5. And then in a way that really lets down our poorest and our sickest patients, you can't get to the doctor Monday through Friday 9 to 5, have your copay, have your insurance, have a boss that will let you off work, have car insurance, have gasoline. It's a lot of moving pieces for a poor patient to get to the doctor, let alone if that take up 3 buses and 4 routes, and that takes even more time, and get back to get their kids for school and whatnot, versus a phone call, a text message, an email, where they can talk about their depression, their anxiety. A lot of people will talk about that more openly by email than they will face to face, because they can take the time to think through it. There's not the judgment. They can pour their heart out, and that's better care. And it didn't cost them car insurance or a day off work. Now, or they woke up at 2 a.m. and were worried about something. They can communicate by email with the doctor that will read that in a few hours. So it really is a care model designed to close up all the gaps that a lot of our most at-risk patients are falling into.
Sure. And even like you were saying, with individuals who have insurance, what I have seen as well is patients have waited till they're really sick to come in, because they know that even though they have insurance, they're still going to be responsible for the first several $1,000s of deductible. So what are we seeing? I was seeing sicker patients because they really were waiting.
Right.
And this, having the affordability and the accessibility really helps them to not feel like they don't have to wait. Look, I can do this. I mean, we have all these memberships on things that half the time, and soon in a couple of months, so their memberships are going to go sky high and probably unused. But we have, this is so important, and I love the patients who really value their care, value that relationship to be able to get the help that they need from a small town doc per se. I mean, growing up from the islands, I came from a tiny town, and so that was always my vision, like that small town doc
Yeah.
vision. Um,
I
to
think it's interesting because so many doctors or policy people have this concept that healthcare is too important to apply business sense to, and I understand why they say it. But then, for something like Blockbuster to Netflix, for $10, a movie and a late fee at Blockbuster, you got one thing, and Netflix comes along and says, for $10, we'll give you this huge value. Why? Because you don't know when you're going to watch a movie, and how many movies you're going to watch, and all these other, and what movies you'll like. So they found a business model that allowed a lot of wiggle room and overlap. And in healthcare, we have this fee for service, Blockbuster-esque. You've got to come. Maybe your doctor does or doesn't have time for that, or does or doesn't specialize in that. But you have several other issues, so you don't know how much healthcare you'll need or when you'll want it. But when you want it, you need it now. And you want it from someone that you trust and knows you and will have continuity with you. So a business model with all of these multi-sided concerns with all the unpredictability of that lends itself very well to a membership model. Now, a direct care clinic can offer memberships based on age and not on pre-existing conditions because there's enough overlap to smooth out those concerns. So it really is a sound business strategy for taking care of a complex problem.
Yeah, I really think I agree that those chronic medical conditions that really, patients need to be in contact with their physician with, and feel comfortable. Okay, if I have an issue, I can follow up. I mean, this is where the value for a direct model really comes in, and so much of our healthcare costs are spent trying to help people with these chronic medical conditions. When really, if they have accessible, high quality primary care,
Right.
then we save dollars to the
Right.
system, and we help our patients get healthy. They want to listen, they want to come in, they want to get that advice from the docs, and get the help that they need. So
In long term, that'll even make their insurance more affordable.
yeah.
If we can, in our experience, we can decrease insurance premiums by 30 to 60%, which means you can cover more people for the same or less money.
Yeah.
But now it's more like car insurance or homeowners insurance. I'll do my lawn care, but if a fire moves through, then I've got insurance for that. At blood pressure medicines for a penny a pill, we don't need to insure it. It's cheaper than the stamp.
Right.
There's ways for doctors to make things so much more affordable, and that supports insurance within as being a player in the system because it puts it back in the proper alignment of, yes, you'll be back there for the big stuff, but the majority of your care can be direct between the doctor and the patient in a very unique and customizable way.
And I know one of the challenges some patients have had in the past is, well, is this, ACA compliant, all that stuff, and knowing that, as of next year, 2019, they're not going to be penalized
Right.
for that, then, at least that's something we're not going to have to, they're not going to have to stress out about. And there have been some changes, at least I know in the state of Florida, for example, and there's another DPC doc that we'll be talking to in a few days, who's a doc here, Dr. Lee Gross, and he was really instrumental in helping bring that option to patients. And I know you, Josh, have been so active for not just patients locally where you are, but nationally, because you're bringing that awareness, you're bringing that word to those that are making the decision, those decision makers, and I really appreciate that. And your patients, I'm sure, really appreciate that. But as a country, really having education about this option is so helpful, and I think
It's a grassroots movement. Yeah.
yeah. So at least we know next year they don't have to worry about being penalized by not having an ACA plan. And actually, I'll be having another physician, Dr. Chad Savage. He's going to come on and he's going to talk about what some of the options are for patients, because we're right now in the midst of open enrollment and making decisions about insurances. And I'm personally doing that myself, for me and my family. So, everyone's in that mode. And so the purpose of these talks is just to bring awareness to this direct care model and obviously answer some questions. So you know, if people have questions, they can certainly, post it and email it. Before we close out here, Dr. Josh, can you tell us where you are and where people can find you?
Yeah,
In case they are looking for an awesome doc.
we're in Wichita, Kansas, and if people have questions, they can reach us on our Facebook page, facebook.com/AtlasMD. Our website is atlas.md/Wichita, and we're on Twitter as AtlasMD. And we try to help doctors and patients find each other across the country or answer those questions, because it truly is a grassroots movement where together we can do so much more to move this from a small piece of the healthcare pie to, I really think, the mainstream.
Absolutely. Well, thank you again so much for joining us today. For those of you who are listening, again, my name is Dr. Sasha No. I'm your dual doctorate, board certified, award-winning physician, researcher, best-selling author, international speaker, medical cannabis expert, and expert in preventative health and chronic disease management. And we help patients through our direct family care plan find affordable, accessible, high-quality healthcare. So if you want more information, go to our website at directfamilycare.com, and you can download our free PDF there that lets you know how you can save thousands of dollars using our direct family care plan. You can always post any questions that you may have. Follow us across all social media at Dr. Sasha No. That's DrSashanoE. And again, the website for direct family care, our direct family care plan is let me see if I can spell, DIRECT FAMILY.com.